नॉर्मली जे ब्लड फ्लो
The other common mental health issues.
Saturday college चालू
Hello, am I audible?
Yes.
Yes, ma'am.
Okay. So, good morning to one and all present here. Welcome to today's e-conference on adolescent mental health. I, Ms. Seema Borisa, Assistant Professor, Mental Health Nursing Department, Dinsha Patel College of Nursing. I heartily welcome you all for today's conference. Now, I would like to invite Professor Virendra Jain, sir, Principal and Organizing Secretary of this conference, Dinsha Patel College of Nursing, for welcoming remark.
Hello. Seema, my voice is audible?
Yes, sir.
Okay. So thank you, Miss Seema. Once again, good morning, all of you, and Jai Maharaj. On behalf of Dinsha Patel College of Nursing, I warm welcome all the dear students of Dinsha Patel College of Nursing and other nursing institute. I warm welcome in this today's conference, which is organized by Department of Mental Health Nursing on very interesting topic, which is adolescent mental health. Regarding this subject, we have organized a two session of today's conference. The first session, which is delivered by a very respected sir, Mr. Irsanga sir, faculty of nursing from AIMS College of Nursing, Jodhpur. I welcome you, sir, for joining this session and accepting our invitation. I welcome you, sir.
Thank you, sir.
Our next session is speaker, Mr. My friend, Mr. Jayesh Patidar, sir. He is associate professor at Gitanjali College of Nursing, Udaipur. I welcome
Thank
you,
you,
sir, for attending this session. So,
Thank you
dear
very much.
all my students, as we all know, at present scenario and this COVID era, the mental health issue is a very big challenge, and nowadays it is increasing day by day. So, we keeping this subject, the Department of Mental Health Nursing organized a very good talk on adolescent mental health and its challenges and its management. So moving forward, once again, I welcome you all the participants and dear all faculties who have shown their interest to attend this conference. Welcome you all once again. Thank you. Over to you, Ms. Seema, madam.
Thank you, sir. Adolescent, it is a crucial period for developing the social and emotional habits, importance for the mental health well-being, multiple factors that are affecting the mental health. The more risk factors adolescents are exposed to, the greater the potential impact on their mental health. Emotional disorders are the common among the adolescent. Anxiety disorder are the most prevalent in this age group. So it is estimated that 3.6% 10 to 14-year-olds and the 4 to 6% 15 to 19-year-old experience in the anxiety disorder. So nowadays mental health issues increasing the day by day. So it is also necessary to promote the mental health well-being. So here we have a knowledgeable and the excellent speaker who will give us the knowledge about the mental health issues and the prevention in the youth. So now moving toward the session 1, common mental health issues in youth. So before starting the presentation, we will have some glimpse of his career in nursing profession. So now I would like to introduce our today's presenter, Mr. Irsangappa Murkavi, Faculty of Nursing, All India Institute of Medical Science, Jodhpur, Rajasthan. I welcome you, sir. Sir has post-graduated in psychiatric nursing from Rajiv Gandhi University of Health Science, Karnataka in 2012. Sir is pursuing PhD in nursing from Indian Nursing Council, New Delhi. Sir has completed basic course in biomedical research from Indian Council of Medical Research in the year of 2021. Sir has also completed Certificate of Excellence in Peer Reviewer course from Elsewhere Research Academy in the year of 2021. Sir has more than 8 years of work experience as a faculty from the both AIMS Jodhpur and AIMS Rishikesh. Sir is a member of the International and the Indian Society of Psychiatric Nurse, National Research Society of India, and the Trained Nurse Association of India. Sir has guided many UG and PG research project and published total 18 research articles in the index and the non-index journals. Sir has presented 8 papers in the national and the international nursing conferences. Sir has achieved Best Teacher Award in the year of 2014, Sarvodaya College of Nursing, Nagpur, Rajasthan. Sir is a gold medalist in the district level yoga championship, master trainer of the breath and the meditation program. Once again, welcome you, sir. So if anybody have any questions during the presentation, please they can type them into the chat box. Now I hand over the session to sir. Over to you, sir.
Good morning to all the audience. So, madam, am I audible?
Yes, sir.
Okay, so at the outset, I would like to thank the organizers of. Pardon? Okay. So at the outset, I would like to thank the organizers of this particular wonderful webinar. So I would like to thank the principal of Diksha Patel College of Nursing, Gujarat, and also the Department of Mental Health Nursing, Diksha Patel College of Nursing, Gujarat. So I was asked to deliver a speak on the particular topic, which is can I share the slides, ma'am?
Yes, sir.
Okay, so let me share my slide. I hope it's visible to you, ma'am.
No, sir.
So,
It is not visible, sir.
okay, I will just try, ma'am.
Okay, sir.
I think you need to make my host, ma'am, so before I need to share my slide.
Sir, I already make you host.
Okay, ma'am. So is it visible, ma'am, now?
No, sir.
Okay, I will try. Is it visible now?
Yes, sir.
Okay. Okay, so good morning to one and all. So I was asked to deliver a topic, speak on particular topic, which is adolescent mental health, which is a need of an hour because adolescent itself is a period of a stressful. As we all know that the adolescence will, it's a period of a transition, the number of ways because they will be get transition in the biological and psychological way and most of the such social aspects also. They try to explore their identity and the most important thing is uh, adolescents who are having the good coping abilities to cope up with the particular stressful situations. So they definitely come out from the particular stressful situations which are commonly occur in the adolescence period. And at the same time, the most of the students, they feel more stressful and they may enter into the crisis because they don't know how to utilize the coping abilities which they already have, or they might use the maladaptive coping abilities, so which are end up with the one or the other common mental health issues during the time of adolescence or the youth period. So today I'm going to deliver a speak on the which is the most important thing for the adolescents mental health and what are the some common issues they will be facing during the time of adolescence or the time of youth. The content I'm going to cover, that is what is health and mental health, what do we know about youth and mental health. It's a very important thing, and how the personality will have the implications in developing the adolescence and prevalence of mental health issues. What do we know about the global scenario and as a citizens of India, so we need to be know about how much prevalent in India. So are some adolescents or youth vulnerable to the mental health issues? So if they are vulnerable, and what are the factors they commonly affected by? So next we are going to discuss very important thing in detail about the which are the most of the common mental health issues which we generally observe in the adolescents, and definitely they will be having some consequences on the adolescents health and mental health specifically, and what are all the changes we will be observing on them, on their behavior, maybe on their performances. Okay, and most important thing is how as a healthcare providers how we need to be assess their needs and how to assess them, okay, to identify one or the other mental health issues. And very important thing is we need to be identify them at the earliest possible, and appropriate interventions and multimodal therapies are available which are very much specific to the individual health problems, and by that we can able to address their issues at the particular need of the time. As we all know that, so the WHO has defined the health, okay, health is a state of complete physical, mental, and social well-being, and not merely an absence of a disease or infirmity. So, as we all know that as the WHO defined in its particular definition, so mental health is an integral part of health. Without the mental health, so there is no health. What do you mean by mental health? Again, the WHO has given some very clear definition on the mental health, which defines that it is a state of well-being that involves being able to recognize a person's own abilities. Okay, very important thing is most of the times adolescents, they fail to identify what strengths and weaknesses they are having. So rather giving more importance to their strengths, so they will be giving more importance to their weaknesses and how they are coping with the normal stressors. Every one of us will experience different kinds of the combination of stressors in our day-to-day life. The important thing is the person who know about how to do primary appraisal and secondary appraisal, so they will be accordingly, they will be taking or utilizing coping abilities to come out from the particular stressors. A very important thing is the work productivity. Okay, so whether we are going to able means the adolescents, whatever the objectives they are having in their life, it may be a short-term objectives or long-term goals. Thing is how they are achieving those objectives at a particular time by managing their personal life and academic requirements. And last one is the contribution to the society, so which is the main purpose of being born as a human beings. Okay. Next, what do we know about the youth? Okay, so youth is best understood as a period of a transition from dependence of childhood to adulthood independence. As we all know that, especially the parents and teachers, they are the main stakeholders of the children and adolescents. So in the childhood, the children are most of the time they are dependent on their parents or the caretakers. Once they grown up to the early adolescence or the adolescent period, during the time of younger adulthood or youth, we can say is that, so they started to identify, they started to find out their identity in the family itself, in the outside the family, and what is their identity in the schools. Okay, so in these aspects they are very much interested, and they're trying to explore themselves in different aspects of their life. The United Nations, for statistical purposes, define those persons between the ages 15 to 24 as a youth. Okay, but however, there is some contradictory definitions. The UN entities, okay, as you can see in the particular slide, the different entities will be considering the age of particular youths in a different way. First, the UN Secretary, they consider youth, the age group between the 15 to 24, whereas UN Habitat is consider the youth as a 15 to 32 years of age. The UNICEF, they divided the youth in three different categories, like adolescents, whose age 10 to 19 year is considered as adolescents, and young people, they consider the people who are between the 10 to 24 year age group, and youth 15 to 24 years. And UNICEF, the Convention on the Right of Child, they consider child until the 18 years of age. Okay, but the African Youth Charter, they consider youth as a 15 to 35 years of age group. So there is some contradictory definitions of the categories, but for this particular presentation, I would like to go with youth 15 to 24 years and adolescents from 10 to 19 years of age. In India, 24% of people aged between the 15 to 24 years, and youth have the creativity, potential, and capacity to make change happen for themselves, for their communities, and for the rest of the world. Because they're trying to explore their own insights about on a particular aspects which are happening in their life in a day-to-day aspects. They're trying to redefine their own self concepts, and they're trying to get a new ideas, okay, on a different perspectives of their life. So if someone says something about on any particular topic, so without any logic, they will not be considered that particular comments, okay, because they're trying to know the logic behind each and every existence. So that is the reason they are more creative, they are more potential to build a nation also. Mental health difficulties or any kind of mental health issues are most common in the adolescent period. As I told you, adolescent itself is a stressful situations. So they may respond to these particular events, and whenever with respect to their academic life, with respect to their career, and what important decisions they have to take at a particular transitions, if they're having particular support system, they definitely come out from these stressful situations. Every year, International Youth Day will be celebrated on 12th August, whereas in India, we celebrate the National Youth Day on the 12th January in the remembrance of the birth anniversary of Swami Vivekananda. What do we know about why we should study the mental health of a youth? Why the mental health we should give the more importance, okay, as in the importance which we given to the physical health. So why we should give the more importance to the mental health? The mental is a very much fundamental to each and every one of us. So not only specific to the adolescence period. So no matter in which particular age group we are, so mental health is will contribute its implications when we define health as a general. So mental health is a fundamental one to good health and well-being. It influences social, economic outcomes throughout the life. So childhood and adolescence are very crucial time, so for laying a foundation for healthy development and good mental health. So children, their emotional well-beings, so they always attach the emotions which in each and every activities, okay, they are having emotions, they attach the emotions with their peers, with their life, with the sports, okay, with academic activity, whatever the activities they will do in their day-to-day life, the emotion behind it, and which will drive them means to behave in a such particular manner. Good mental health helps them to develop resilience is very much important. So how we cope up with particular stressful situations? If you consider the COVID in a recent time, all of us are the victims of a COVID, okay, as we know that. And there is a belief that adolescents, they are having well coping abilities with the particular pandemic, okay, which every one of us have experienced, but it's not. So adolescents, they may also get affected because of the many such situational or the mass stressful situations. And thing is, what kind of resilience they are having to cope up with these unexpected situations. Okay, so that will make them to face many such situations, and they make them to develop their own experiences with respect to their life. What the common changes which may occur in the adolescence period? We all studied the physiology and of a particular human beings. So we know that in each transition, the growth and development of each and every individual, so the transitions will occur at a particular time. So adolescence is a one particular stage group in our life. So most of the changes will occur in terms of biological, cognitive, and the sociological changes. So if you divide the adolescence in three categories, early, middle, and late stage, the period between 10 to 13 years of age is considered as early adolescence, and period between the 14 to 17 years are considered as a middle adolescence, and period between the 18 to 21 is or beyond it is considered as a late adolescence. So what changes will occur biologically in the early adolescence stage? So there will be a growth spurt, skin, voice, and body hair will changes, increasing the body fat, and development of a secondary sexual characters will be starts to begin. Cognitively, they started to think abstractively and logically. They try to understand the logic behind each and every aspects which are happening in their life, and firmer grasp on the cause-effect relationships. Okay, if someone says something, they never believe it. They're trying to identify what is the cause behind it. Okay, and what social changes will occur. The thing is, due to this, all the biological and cognitive aspects, the children will start to increase their interest in this opposite sex, and adjustment to the independence and self-reliance will be happens. So in the middle adolescent age, the secondary sexual characters will further develop. So in response to the high levels of androgens and the secretion in the particular person's body, and which will leads to desire for sexual stimulation, leading to sexual maturations. Cognitively, the adolescent become more mature emotionally and intellectually, and abstract and logical thinking, hypothesis testing will also increase parallelly. And autonomous functioning, they're trying to do each and every activities independently based on their level of thinking. Socially, again, they seek some kind of distinctiveness. They're trying to lead a life independently. Okay, they may stay in the hostel, they may stay in the outside the house. Okay, for their academic activities or some other their to fulfill their life goals. Okay, the peer relations will be given more importance at the particular middle adolescence age group. In the lately, adolescents achieve the physical maturity and cognitively have established self-identity and bolster self-esteem, which is enhancing day by day. Okay, how they complete their each and every goals in their life, the self-esteem will also grow. Okay, so the parents will play very much important in developing a self-esteem of adolescents. So adult cognitions are also present, and they may be having some clear plan for their future. They will start to do career choices, and they will be start working upon it. They also establish more intimate relationship with the opposite sex. So these are all the changes are very much common for each and every adolescence. What personality wise, what all the changes may occur in the adolescence that we observed in the each and every youth? What do you mean by personality? So personality is it which refers to the deeper ingrained patterns of a behavior, so which includes the ways one relates to the and how they will perceive and thinks about the environment and about oneself. This is the definition which is given by the American Psychiatric Association in the year 1987. So how do we know about which behavior appropriate at particular developmental stage? Okay, to understand that, the various theories of personalities and personality theorists, so they have given some clear definitions regarding age appropriate behavior, what to expect from what particular time from males and females. To be optimal mental health in essential is for the optimal functioning as well for the productive for any particular person. As we all know that adolescent is a very much crucial developmental period, and many of the adolescents, they're trying to redefine their self concepts. It means how they look, how they matters to others, and what is their role in the schools, and what changes they can able to make, okay, in their family, to the society. Okay, so because of these things, they're trying to redefine and reconstruct their self concept, and that will leads to various intellectual changes will be happen within them, and related emotions also will be carried out. Developmental theories, they identified the age appropriate behaviors to each particular stage. Okay, that is very much important. So as we already know about these all the personality theories, as a healthcare providers, they will help us to, these theories will help us to identify the appropriate and inappropriate behaviors at each particular developmental stage, and we can able to assess their needs, okay, based on their developmental stage, and necessary interventions can be taken. As I told you, the different theories, they have defined the expected behavior or the milestones to be achieved at each particular time. As the father of psychiatry, the Sigmund Freud, so in his psychoanalytical theory, he defines that the adolescents who are in the latency and genital stage, it is a very quiet stage in sexual development and learn to socialize. Generally, if you see, the sexual maturity will be occur, and the adolescents try to get satisfactory relationship with the opposite sex. And Eric Erickson's theory, which is a very much popular one in the theory of psychosocial development. So he defines adolescence is the stage of the conflict between the identity versus a role confusion, which is a highly critical transition period because adolescents become more independent and begin to consider the future in terms of relationships, families, and careers. And third theory, which is a very much we will be applicable these implications in the cognitive behavior therapy. This theory, which is developed by the Jean Piaget, so he defines that adolescents they will be develop complete formal operations of thoughts. They can think as like adults. Okay, they can generate their own thoughts. They can think logically, abstractly. They can plan anything. They can implement their plan. Okay, so they learns to think and reason in abstract terms, and further develops logical thinking and reasoning and achieves the cognitive maturities. What important thing is we need to understand from these theories, the failing to achieve a successful completion of a milestone at each particular specific age may lead to the mental or behavioral issues in the adolescents or youth. Next, very important thing is if there are any adolescents who are experiencing a kind of stress or the crisis in their situation in their life due to maximum utilization of the maladaptive coping abilities, they definitely end up with one or the other mental health issues in their life. So how much prevalent the mental health issues or common mental health issues in the youth? You know that the fact is 1 in 6 people are aged between 10 to 19 years, and adolescent is a very unique and formative time. As we know that in India, if you consider the 65 crore of the Indian population are under the age group of 35 age. We can say that we are the youngest nations. Okay, we are having more youths. So we should give the more importance to the mental health. That is also equally importance as we give importance to the other aspects of health. You know that the physical, emotional, social changes are common in adolescence period, which may include exposure to the poverty, abuse, and violence, and can make adolescents most vulnerable to the mental health problem. Protecting adolescents from any kind of adversity, and promoting socio-emotional learning and psychological well-being are very much important, and ensuring access to mental health care is critical for their health and well-being during the adolescence and adulthood. We can see the global scenario here, how much prevalent the common mental health issues in the youth. Globally, 1 in 7 10 to 19-year-old experience some mental health disorders, which will accounting for 13% of global burden of a DC in this particular age group. So this amounts to an estimated 166 million adolescents, which comprises 89 million boys and 77 million girls are affected by the common mental health issues globally. Which are the common mental health issues which are experienced by the or suffered by the adolescents? The depression, anxiety, and behavioral disorders are most commonly we can able to observe, and they are the leading cause of illness and disability for adolescents. Okay, and very important thing we need to be more. Why we need to more focus on adolescents' mental health, because the suicide is a 4th leading cause of death among 15 to 19-year-old age group youths. And if you see this particular, there is a difference between the male and female or the boys and girls in this particular age group. The male, the death due to the suicide is very much common, as we see, and in the female, the attempt rates are more. Okay, so nearly 50% of adults psychiatric disorders, they begin before the age of 14 years. So you just imagine that how much intensity it has, how much percentage contributing in their nation's health. So with respect to the gender wise, if you consider the prevalence of the common mental health issues, The 44 million of boys in the age group of 10 to 14 years are affected with the mental health illness, whereas the 34 million of girls in the age group of 10 to 14 years are affected with the mental health illness. So this is somewhat different in the 15 to 19-year age groups. That is 44 million boys are affected with the mental health illness, and whereas 41.7 million girls in the age group of 15 to 19 are affected with the common mental health illness. With respect to the specific common mental health issues which we commonly observe in the youth, globally, if you see that the 42.9%, there is a majority of the adolescents will experience the anxiety and depressive disorders because of the number of causative factors. 20.1% they may suffer with the conduct disorders. 19.5% they may suffer with the ADHD, that is attention deficit hyperactivity disorder, and 14.9% they may be having some any kind of developmental intellectual disabilities, and remaining mental health disorders will have the contribution of 9.5%. If you see the top 10 causes of death for adolescent boys and girls between the age group of 15 to 19, so in the boys it is the fourth leading cause of death, and in the girls it is the third leading cause of death due to the suicide. Okay, so you can see that how much importance we need to give for the suicidal ideations and to identify their high risk behavior, those who are having ideations to kill oneself. Specific to the particular prevalence per 100 15 to 24 years olds, 6.42% of males may be suffering from the depressive disorders, and which is more in the females, that is 8.86%. With respect to the anxiety disorders, the females will be suffer more, that is 11.49%. And with respect to conduct disorder, the 8.66, that is more common in the males. Because conduct disorders are more commonly, ADHD are more commonly in the males we will be observing, because they are the most common behavioral and emotional conditions which we observe in the adolescents. Autism spectrum disorder is a one more condition, the males will be get affected more, and eating disorders are more commonly we can observe in the girls, adolescent girls, than the boys. So in India, if you see the specifically with each particular condition, the most of the it means nearly 50% of adult psychiatric disorders, they begin before the age of 14 years. So you could imagine that what impact it has, okay, in developing the good mental health of adults. Very important thing is, by considering all this knowledge, the previous knowledge, we can able to imagine that what definitely affect the mental health of adolescents. Okay, there are a number of factors will affect the mental health of adolescents. So biologically, psychologically, socially, okay, and environmental factors, psychodynamic factors, they will be affecting the mental health of adolescents. So the majorly the absence or imbalance of personality structures, because the id, ego, and superego are the three important components of the personality structures. If there is an imbalance between these three personality structures, so definitely adolescents may develop one or the other mental health issues. Traumatic life events, for example, if there is a death of any loved one in the family of adolescent, and frequent losses in their family, in their life, that will also leads to the stress and the more complicated grief. Changes often act as a triggers. For example, adolescents may move from home, they may stay in the hostel, or they may go for the project work. Okay, they may change their schools because of the number of reasons. The birth of a new sibling is also one more the significant change in the life event. And if there is any conflict between the siblings, what kind of interpersonal relationship they are having, okay, and addiction to video games is very much important. Okay, we need to be focused in today's adolescents mental health life. And there are so many factors they will be triggering the mental health of in adolescents. Teenagers often experience the emotional turmoils as their minds and bodies develop. And most important thing is the coping with the particular stress or as transitions which may occur in the adolescence time. So those adolescents who have adaptive coping mechanisms, they definitely come out from this stress. Okay, whereas some of the or not the majority of the adolescents, they will be utilizing the maladaptive coping mechanisms, and they definitely end up with a, they may get a temporary solution for them, but they definitely end up with a long-term stress. Okay, so better thing is we need to be train them, or we need to educate them how to utilize the adaptive coping mechanisms during the time of stress or the transitions. Next, very important thing is there are some vulnerable population or vulnerable group in the adolescents. They are very much risk for the kind of mental health issues. Okay, so what are the factors which are very much which makes the adolescents are more vulnerable? For example, any adolescents who are having long-term physical illnesses, and their parents, if they're having any kind of a mental health problems or problems with alcohol, or if they're quarreling with each other, if there is no proper psychodynamic factors in the family, and if there is a any prisoner parent, one or the both the parents, if they're having any trouble with the law, that is also one factor. And the parents who live separately, or they may apply for the divorce, death of someone which is very much close to the adolescence, they will also having a more impact. Okay, which is itself is a stressful. According to the Holmes and Rahe, the life events, okay, especially the death of someone, which will makes the more stress. Experiencing severe bullying or physical or sexual abuse, poverty or homeless is a one thing, and stigma and discrimination. Those adolescents who experience the stigma and discriminations, definitely they are vulnerable to the mental health issues. And caring for a relative are those adolescents who take in their earliest life, they take adult responsibilities because of the absence of their parents, because of their life responsibilities, and having long lasting difficulties at the particular school. They may be having difficulty in performing academically, or they may be having some issues, okay, to come out from the particular subject, or there may be a frequent failures in a particular subjects. So these are the very much concern. So they require academic counselings by the professionals. And very important thing is the pregnant adolescents is a very much concern. In Western countries, it's a matter of a issue. Adolescent parents is one more thing is because they may not having that maturity to take care of their children, and or those in early or the forced marriages. So these are some of the factors, are not only confined to these only factors. There are some other factors may also which makes the adolescents more vulnerable for the mental health issues. So we cannot we cannot avoid the impact of a COVID-19 because we are all the victims of a COVID-19. If you see that last 2 years and even this year also, we have been experiencing a number of waves and their impact on our health. The COVID has made the impact on all the age group of people irrespective of adolescent period. The UNICEF has conducted a survey on adolescents, so to identify the COVID-19 crisis, so and what particular changes we have been in terms of mental health have been observed in the adolescent youth of Latin America and Caribbean. And they found that, so they have did a study on 8,444 adolescents in the age group of 13 to 29 in 9 countries and territories in the particular region. And they reported that 27% of young women, they feel more anxiety, and 15% they feel they are depressed due to the COVID. 1 in 2 feel less motivated to do some activities in their normally as they do in their normal life. 43% of young women feel pessimistic about the future as compared to 31% of men due to the COVID-19. And among those who felt need to ask for help regarding their physical and mental health well-being, 1 in 3 asked for the help from their closest circle, maybe from the family or maybe the friends. 3 out of 4 have felt the need to ask for help regarding their physical and mental health well-beings due to the impact of COVID-19. Despite having felt the need to do so, 2 out of 5 did not ask for help, which is contributing about the 70% also of people were not seeking the help for their impact of the COVID-19. So next very important thing is we need to be specifically observe how the individual mental health issues and what is their prevalence in the adolescents or the youth. Okay. Specifically, if you see the anxiety disorders are the most commonly or most prevalent, as we see in our previous slides, among we can able to observe in the young adolescents. It is estimated that 3.6% of 10 to 14 year adolescents and 4.6% of 15 to 19 year would experience the anxiety, according to the National Institute of Mental Health data. Anxiety can severely impact adolescents, and it often therefore interferes with the teens' ability to socialize with their friends, interferes with their education, difficult for them to speak up in the class or anywhere in the outside the home. The second most common condition which we observe, that is a depressive condition. Depression is estimated that which will occur 1.1% of adolescents within the age group of 10 to 14, and 2.8% of 15 to 19 year old will get affected by the depression. The girls are more likely to experience the depression than boys, and symptoms are severely impact their social and academic functioning. Social withdrawal can exacerbate isolation and loneliness. If you see the depression symptoms, so they may, and the pattern of thoughts, they make them isolate and they feel lonely. And also they may having the low self-esteem. Depression can lead to a suicide, because you know that suicide is the fourth leading cause of a death. So depression has a major contribution in the suicide and to generate some kind of ideations. The next thing is ADHD, that is attention deficit hyperactivity disorder, which is the most common behavioral condition which we observe in the young adolescents. Attention deficit hyperactivity disorder, which is characterized by difficulty paying attention, excessively, they are more active and more talkative, and they are easily distractible, and they are very much sensitive to the stimuli which are present in the surrounding environment, and acting without regard to the consequences. We can say that they are having a kind of a reckless behavior, okay, which occurs 3.1% in 10 to 14 years olds, and 2.4% of 15 to 19 year adolescents are get affected. So there are three types of ADHD: hyperactive type, inattentive type, and impulsive type. And there is according to the National Institute of Mental Health, the children may affected any kind of ADHD, and some children may have the combination of the ADHD also. The next important condition is ODD, that is oppositional defiant disorders. Though we cannot, it is not most prevalent, but this is having some important contribution. So here, which is characterized by the extreme defiance. The children refuse to obey the rules and regulations which are set by the teachers, or which are set by the parents or their elders. And there will be a verbal and physical aggression and spitefulness. They're trying to hurt another person without considering their rights. Okay. According to the American Academy of Child and Adolescent Psychiatry, so anywhere from 1 to 16% of adolescents are get affected by the oppositional defiant disorder. So teens with the ODD, they struggle to maintain the healthy relationship, and often their behavior interferes with their education. So if they are left untreated, so definitely it can lead to the conduct disorder, so which is a most serious behavioral condition we observe in the children. So what do you mean by conduct disorder? It is a serious behavioral emotional condition. A child with this particular disorder may display a pattern of disruptive. They may violent on others, or they may violent on themselves also, and they may have the problems following the rules which have been set by the schools and colleges, or even the general rules of a house. The conduct disorders may occur among 3.6% of 10 to 14 year old children, and 2.4% of 15 to 19 year youths get affected. So behavioral disorders can affect the adolescents, education, and their academic performance, and also they may affect their achievement in the scholastic activities. And conduct disorders may lead to the criminal behaviors or antisocial activities. Very important thing is the eating disorders, okay, which are, as I told you, which are very much common in the adolescent girls than the boys. There are three forms of eating disorders, namely anxiety, anorexia nervosa, bulimia nervosa, and the binge eating disorders. What do you mean by anorexia nervosa? Which is characterized by the extreme food restrictions and the weight losses. The third year students, they may not know that they have studied in the psychiatric nursing. So these are the they have been classified under the neurotic and stress related conditions. So the girl who suffer from anorexia nervosa, there will be a huge loss of weight without considering their physiological functioning. What do you mean by bulimia nervosa? So which involves binge eating and purging. Okay, the important thing is, what is the difference between the bulimia nervosa and the binge eating is the purging. Okay, so bulimia nervosa, there will be a purging. The particular person may use the vomiting, or they may use some kind of a laxatives, okay, for the purging. And binge eating disorders, which involves the eating massive quantities of food at one particular time without the purging, and later they may feel very guilty because of their binge eating behavior, and they may feel very much ashamed of themselves whenever they are attending some functions outside their house. Eating disorders among the teens, like 13 to 18 years, they approximately affect 2.7%. So, and which is more commonly we can observe in the females than the male. Next, the common mental health issue we can able to observe in the adolescent is the suicide and self-harm. Okay, as I told you, what do you mean by suicide or the self-harm? Intention to kill oneself or a deliberate self-harm is defined as the suicide, or intention to end their life at one particular reason or number of reasons are responsible for these particular ideations. As we know that suicide is the fourth leading cause of a death in older adolescents. There might be a number of a combination of factors which are responsible for the suicidal ideations, which may include other than that, like some risk-taking behaviors, like harmful use of alcohol, abuse in a child. It might be a emotional abuse or the physical abuse by others, and stigma against help seeking. So that is the reason most of the adolescents, they feel they hesitate to ask for the to seek particular professional help. Okay, they not even get help from their peers. Barriers to accessing the particular care and access to means of suicide is one more factor. They may act like a riskier one. And one more important thing is the influence of the digital media, okay, which is having more pros and cons. Why? Because the most of the adolescents, they get help. We can able to means the digital media has that capacity to prevent the adolescents to end their life. At the same time, the adolescents will get more means, okay, the different kinds of a means, okay, to end their life, okay, because of the this particular availability of the internet or digital medias. Okay, they may actually, the most of the adolescents, they may only having the suicidal ideations, but they don't know by using what kind of a means and what kind of a planning they can utilize to end their life. Okay, so most of the adolescents, they may think about taking poison is a one particular means. Most of the adolescents, they may think of hanging themselves. That is also one more means of ending their life. And Some other adolescents, they may think of jumping from some heights. Okay, so like this, there are some different means are there. So these kind of different informations they may get from the digital media. That is the reason the digital media has both pros and cons. So next important point is the risk-taking behaviors are very much important here. The adolescents, they may be use excessive kind of substances, the multiple substances they may use, they may involve in the sexual risk-taking behavior. They generally start during the time of adolescence because of the curiosity, because of they wanted to prove themselves, okay, in front of the others. And other risk-taking behaviors, these are all helpful and unhelpful because they are all maladaptive coping mechanisms. Okay, they may end up with one or the other mental health issues. Worldwide, the prevalence of heavy episodic drinking among adolescents between the age group of 15 to 19-year-old was 13.6% in 2016, and which is more common in the males. The use of tobacco is one more matter of a concern, and use of a cannabis or multiple substances are most prevalent nowadays. Okay, if you take a example of like our own state, like in Western Rajasthan, the use of opioids are more common. Okay, so it's a matter of concern here. Okay, we are giving more importance to their adolescent health, and we are organizing some of the community outreach programs for the awareness of these adolescents, especially in the Western Rajasthan. So many adult smokers and they usually start their cigarette smoking first in the age group of 18. Cannabis is the most widely used drug among young people. About 4.7% of 15 to 16-year-olds using it at least once in a year. Next thing is interpersonal violence was ranked among the leading cause of death of older adolescents before the suicide. So now we have some brief knowledge or the thorough knowledge about the common mental health issues. Thing is how they affect the mental health of an individual, how they affect their functioning. So definitely the the adolescents will get suffer because of these mental health issues in terms of their personal life and family life. And definitely we can able to observe impairment in their functioning day-to-day life, inability to study, inability to work, raise a family, or they cannot live independent life because of these mental health issues. They also leads to they make them to expose to the stigma and discriminations which are still existing in the society, and which may make them isolate, missed opportunities, and they may get abused, okay, from the others. They may also increase the risk-taking behaviors like unprotected sex and excessive use of substances, and which may also leads to premature death because of the violent behaviors, because of interpersonal conflicts, interpersonal fightings. Especially we can see in the adolescent age groups, gang wars, or when they involve themselves in any kind of crimes. Okay, society is one more thing is the the adolescents will die prematurely, and overuse of drugs, okay, and reckless behaviors leads to the premature death. The next thing is, as a healthcare providers, we should know about how to assess the adolescents' mental health issues. Because when adolescents come to the OPDs or the clinicals, we are the persons, we are very much concerned, or we are the healthcare providers. So we should have some thorough knowledge about how to assess. What are the aspects we need to be assessed? We need to assess what adolescent says about his or her thoughts and feelings, and what they says he or she does. So what subjectively they will express, what is their behavior, and observing how the adolescent looks, whether they are looking according to the one's age, or they are taking care of self, okay, and what about their speech, the tone of the voice, especially those children who are having depressed, their tones we can observe very much clumsy. And what other people think about it, Sometimes what happens, the parents may complain about the adolescents, whereas the teachers may not be complaining. Sometimes it is a vice versa. Sometimes the peers will complain that the particular child is having some adamant behavior, whereas the parents, they may not having that particular issues uh, in their particular child's life. So that is the reason we need to collect information from a number of stakeholders of adolescence. Okay, we can able to validate the history. Okay, when someone is saying that this particular adolescent is having some issues, we need to make validation with the others, significant others. Right? Observing the adolescents' interactions with other people, how they behave when they are with the peers. Okay, how they will communicate with others. So we need to be focused that also, and we need to do the general physical examinations. We can able to find out most of the changes physically. They are the initial sign of the one or the other health issues, and we need to go through with their medical records, which will give the previous history of a particular adolescence. The next important thing is we need to assess the physical aspects of the particular adolescence, because most of the mental health issues are having they may show the physical symptoms too. Sleep problems are very much common because of the anxiety are more prevalent, and stress is more prevalent among the adolescents. Anxiety and palpitations are, we need to be assessed. Dizziness and trembling and sweating because of the panics or the severe levels of anxieties. And also we need to be assessed for the general aches and the pains. We need to rule out the what is the exact pathology behind these particular aches. Next, poor appetite or a loss of weight. Whenever the children who are suffering from some kind of eating disorders, so we need to be more focused on their the nutritional habits. Okay, and we also focus on the some other presentations, like some children, they may be a social withdrawal, or they may be feel hesitate to participate in the social activities, work life, and then the society activities or family functions. And they might have declining academic performances or repeated failures in the particular subject. Okay, the signs of excessive and frequent alcohol or psychoactive substance use. And they also report themselves are subject to reports by the adolescents about frequently engaging in the high risk taking behaviors. Lastly, I would like to focus by considering all these facts. Okay, what common mental health issues the youth generally experiencing. It is very much important for each and every stakeholders, maybe your parents and the teachers or healthcare providers, the peers or elders in the family. So they need to be identified these kind of behaviors at earliest, and provide the necessary treatment for them. Okay. Alarmingly, however, 75% of children and young people who experience the mental problems aren't get help they need at a particular time. It is crucial to address the needs of adolescents, which generally experiencing the mental health conditions, and avoiding institutionalization as much as possible. If there is a severe condition, then only make them to get admit in the particular healthcare institutions. Otherwise, we can provide the home-based interventions. Prioritizing non-pharmacological approaches and respecting the rights of a children. This is very much important. So in line with the United Nations Convention on the Rights of a Child and other human rights instruments are very much key factor for adolescents' mental health. Thank you for your patience listening.
Thank you, sir. If anyone want to ask any question, they can ask. Sir, one question from audience. What are the major factors that are responsible for developing the mental disorder?
So I think if you if you focus on my slides, so I have highlighted some of the vulnerable factors. Okay, so which makes them it means like all the adolescents will experience the stressful factor. in one or the other intensity. Some may having the more crisis, some may having the less crisis. Which thing will make the difference is here. The children who know very well about how to use their coping abilities. Okay, they definitely come out from those stressful situations, and whereas some of the children's their behaviors are driven by the id and ego. Okay, so the id always says that it is a satisfying their needs, biological needs. The id never considers the consequence of their satisfactions, consequence of their behaviors. So most of the adolescents' behaviors are id driven. Okay, so definitely we can say that there is a risk-taking behavior, and they may not consider the consequence of their behavior, or they may not consider the ego. So that, and also if they don't know, the majorly very important thing is, if they don't know how to seek a help from the others. Okay, their parents are there, elders are there, teachers are there, healthcare providers are there. Okay, they are there for adolescents. If they never ask any help from them, then how would they come to know that the particular child is having some mental health issues? Okay, so these are the things they make them to get some common mental health issues, and we need to give more importance to them.
Thank you, sir. Sir, one more question. How can we differentiate between the psychosis and neurosis?
Psychosis and neurosis.
Yes.
Psychosis are considered as the major conditions. Okay, so we need to be, for example, with the psychosis, the particular person may die because of the severity of the symptoms, or which will definitely affect majorly to their thought process, their emotions, and their activities too. If they are untreated, definitely they will be end up their life in one or the other stages. Whereas in the neurosis, you know that neurosis means they are originated from the particular they are because of the life stresses. Okay, the condition, for example, if you take like phobia and anxieties, it may be generalized anxiety or specific anxieties, or kind of, if you take example of a OCD, the dissociative conditions, and adjustment problems. Okay, so these are all the the conditions which are generated from the stress. Okay, they are not much severe here, but we need to give the more importance to these neurotic conditions also. So these are the major differences between the neurosis and the psychosis conditions.
Thank you, sir. Sir, one more question. What kind of the education we should provide to the parents as well as to the adolescent about the behavioral disorder?
So adolescent per se, I need to say that what I feel is the parents and the teachers in the primary education, secondary and higher secondary things. So thing is, nowadays it's like we are having a all-round our curriculum is focusing on all-round development of children. Okay, a thing is how much we are implementing it. That makes the difference here. Here the children are scoring more marks. They are getting some good admissions in the particular professional courses, and they are doing good in the academically and even in the sports also. But they are somewhere lacking in the managing their emotions attached with each and every activities of their life. The same thing I highlighted here. We need to more focus on how to confront with the different life situations, because life is full of like situational things will arise at any particular time. So all the stakeholders, we need to educate them how to face the problems, because every one of us will experience the one or the other problems. Thing is how to solve them, how we can utilize the problem solving techniques rather than ignoring the problem, rather than running out of the problem. That is not a permanent solution for the life issues. Thing is, how much importance we are giving to the academic achievement, the same importance we need to give for their to manage their emotions, to manage the different life stressors, how to utilize the coping abilities at a particular point, and how to seek a help, because all of us are not having adequate knowledge and experience to solve each and every problems. Understood? So here, in sometimes we may feel very much helpless. At that moment, we need to teach the adolescents to seek help. It may be from their peers also, it may be from their elders also, from their teachers or anyone on whom they are having some trust. So these are the things we need to teach the adolescent at a particular time period.
Thank you, sir. Thank you, sir, for wonderful and informative session. Or nicely explain the major causes or the issues nowadays people are facing, especially in the adolescent periods. So thank you so much, sir.
Thank you, ma'am.
Now, coming to the session second, prevention and the early intervention in the youth. For that, I would like to introduce our today's presenter, Mr. J.S. Patidar, Associate Professor, Gitanjali College of Nursing, Udaipur, Rajasthan. I welcome you, sir. Sir has postgraduated in psychiatric nursing from the Bharatiya Vidyapeeth University, College of Nursing, Pune, with the second rank in the year of 2011. Sir is pursuing PhD in nursing from Manikaka Topawala Institute of Nursing, Charuset University, Changa. Sir has 5 years of experience as an in-charge principal, Nutan College of Nursing, Visnagar. Sir has total 13 years of teaching experience in the nursing field. Sir has published more than 10 research articles in the various national and the international journals. Sir has presented many scientific papers in the various conferences and awarded with the best poster presenter by the Sumandi Vidyapeeth. Sir is a member of the Indian Society of Psychiatric Nurse, National Research Society of the India, Trained Nurse Association of India, and the Nursing Teacher Association. Sir is a scientific committee member of the International Journal of Psychiatric Nursing. Sir has organized various seminar, workshop, and the faculty development program. Sir has completed the course of the creativity, problem solving, and the innovation under the faculty development program. Sir has successfully completion of the basic holistic health and the full reflectology in the holistic health education and the healing center, Pune. Sir has performed role of the inspector in the Gujarat Nursing Council inspection. Once again, I welcome you, sir. Now, I hand over the session to sir. Over to you, sir.
Hello, am I audible to you all?
Yes, sir.
Seema?
Yes, sir.
Okay. I'm just sharing my slideshow.
Yes.
If you are able to visualize, please let me know.
Okay. Yes, sir. It is visible.
Okay. Okay. First of all, thank you very much to give this opportunity on talk about prevention and early intervention in youth. I'll start with this topic, prevention and intervention in youth. This line, like, everyone have right to mental health, as we well know that prevention is better than cure. There are some lines which can motivate to youth, like today's youth, tomorrow's future. This all will be motivators as a youth when we listen us or listen wherever we are come across. There are some line like young India. Why we say young India? Because we require tomorrow future in safe hand. So as much as population is high, definitely the youngest India we are saying, in similarly in background we also saying that we are more highest depressed country worldwide. These introductions, please forgive me if I'll say wrong or anything to youth, but I'll try my best in these presentations. Whatever I have learned from the demands or UNICEF, I have last 2 days, whatever I come across, which I'm going to interact more or wherever I will be share experience in point of view the example. So first, when I was preparing the slide about the prevention and early intervention in youth, first, what was my mind and what is the youth? As my previous speaker says that youth is a whom we can say youth. It's a bridge between early adulthood, childhood and early adulthood. With this age, some people say the time to 19 years, 15 to 17, age wherever this matter, but okay. The slide is, can you able to see the slides?
Yes,
Seema?
yes, sir. Yes,
Okay,
sir.
okay, just for confirm. Okay, thank you. So, as we said that this is a bridge, youth is a bridge between the early childhood and adulthood. So, there are various changes in youth, especially not only physical but mentally. And when we say physical changes, as we all know that when anything happened to body, definitely is going to affect the mind because it's a vice versa. If something is happened to physical, definitely it's going to affect the mind. So, especially in this age, youth are changes in their physical, like puberty changes. It's a one type of situational crisis. They need to cope up. They are in the dilemma where they are increasing their level of independence, cope up with new relationship, adjust to ever-evolving physical itself. So much things going on their minds. Somewhere they are in academic sites, they have to uh, good achievement, good take. They need to have good rank. So like adults, children and adolescents do have mental health disorder, and they interfere with the way they think, with the feel and act. When these problems are untreated, this lead to school failure, family conflict, drug abuse, violence, and even suicide. When I was preparing this slide, I come across that in Nimhans there is a Monday mood with Samvad, where every Monday, every month of first or fourth Monday, they are giving Samvad to people. Like in they share their where Nimhans OPD 2008 child psychiatric, I'm talking about child psychiatric OPD, where was 2008 there was OPD 4,600 around. And when they taking in statistically 2007, there was 11,000 OPD per day. So this was the drastically changes we can see in the children related to especially youth. And it focus on mid-teenage years and early adulthood, right? So I'm coming to the next slides. If we take, already my previous speaker have given the statistics that how globally, this is the WHO report that 1 in 7, 10 to 19-year-old experience a mental disorder, and 30% global burden of this is in age group. Majority we have seen anxiety, depressions, and behavior disorders. And my previous speaker, sir, very well, he has said that most majority disorder, especially in the adulthood, are anxiety, depressions, behavior disorder, conduct disorder, hyperkinetic disorder like ADHD. So these all causes of illness and disability among adolescents. And suicide is the forthcoming leading cause of death among 50 to 19-year-olds. It's trained to great changes, including physical, mental, intellectuals. Next, if I a little bit more correlate with this, poor adolescents' mental health is also associated with high risk of injury, substance abuse. Children are in this youth, they are very high risk to use substance. As sir has said, in Western Rajasthan, people are using the cannabis and fumes, which will be in this age group, they are directly connected. So disability of chronic illness also are high risk. They are stigmatized and marginalized because of sexual orientation, gender identity, ethnicity, and they are exposed to violence living in poverty, which will be humanitarian, fragile, and vulnerable settings. So these are the some common ones. Again, I would like to recap like child abuse and neglect, conduct disorder, alcohol and drug abuse, depression, attention deficit disorder, suicides, these all are common in youth, and especially notable depressions, which will lead to the people are doing suicides. So the topic which is given to me, that is prevention and early interventions, prevention and early interventions in youth. So we will take like general model what we are learning in other community point of view, like primordial preventions, primary prevention, secondary prevention, and tertiary prevention. So this is the model where we took, this is just outlined. We will, upcoming slides, we will learn about some details. Like we talk about primordials, like how the life skills we have to develop, good parenting, teaching skills, problem solving techniques. This all will be in the primordials. Whereas in primary, we need to be health promotions, specific protections. If we talk about secondary, early diagnosis and treatment, and tertiary, we need to be disability limitations and rehabilitations. So we will try to think, learn deeply one by one, like primordial preventions. Here, majorly, I'm going to highlight about problem solving techniques, life skill approach, de-stressing exercise, good interpersonal relationship, good parenting skills. Whereas in primary preventions, we need to identify the risk factor, risk mitigations, remove the possibility that disease will occur. So in the target group, like risk identifications, like target group is adolescents, whereas we need to minimize, especially community point of view, improving the social environment, promotion of social, emotional, and physical well-being. So primordial preventions I'm going to take first, where, as I said to you, that we are going to more focus on life skills. We need to train the child, he has learned some skills, especially related to life. We also require teaching or teach to require parents to good parenting. We also require how to train the child, like how he can handle the problems. So that is called problem solving technique. So in these primordial preventions, we has to be life skill and social development program, which is designed to help children, especially how they can manage their anger, resolve conflict, social skill, how to be socially, they need to be socialized. By school approach to violence preventions, whole school, sorry, programs that support the teach positive parenting skills, preschool program that provide children in academic and social skills and early age, therapeutic approach for youth at high risk for being involved in violence. Thereafter, reduce the access to alcohol intervention to reduce harmful use of drugs. Community and problem solving orientation policy intervention to reduce concentrated poverty and upgrade. This all about in these presentations. So, life skill approach, how we train or skill to give the child, like they has to be improve their confidence. Normally, what we get, we as a parents, we as a teacher, we as a member of healthcare team, we are not observing their self-esteem, whether they are suffering from which level, whether what about their self-esteem. So normal in the Indian routine setup, like school sites, we always teachers is scolding the students, right? We never motivate them. If they are doing anything good, we have the both sides, pros and cons. If we can scold the child, same set, if we have the right to appreciate also. So that build them self-confidence, respecting self and others. Teach the child or teach the youth that how they have to respect to each other. If you are respecting, they will be build a sort of rapport. Okay, I can talk to anyone. I can have some, I share with my feelings. Interpersonal skills where they require good relationship. They need to be. It should not like that youth cannot talk to anyone. They do not. They should not feel like that. No one is mine in my. No one in this universe who I can talk with whom, or I can share my feelings, or I can express my problems. So allow them to make someone where they will be taught to ventilate their feelings. They also know about their how to manage emotions. Personal responsibilities. Personal responsibility where sometimes we need to give them to responsible, like small work, homework, or a school. Allow them to children as a parents that small little bit of work we can engage with our home daily routine home activities, where they can be able to independence work. That will be help in future in their life. Positive attitude and self motivations. Always to allow them to think in a perspective where they have to think positive. The perception supposed to be in positive sides. Ask them to manage their skill, like in conflict management, how to solve the problems, teamwork. Always believe in teamwork. Like teach the some like in such type of example where we can give simple example like Indian team is playing cricket and in that 50% player are injured or not fit. Whether can we win the match? No. Similarly, if the child is arguing with us that nobody's
Excuse
like
me,
in my
Jay sir.
class.
Jay sir,
Yes, sir.
excuse me.
Yes, sir.
Please, you can switch on your video actually.
Okay, okay. Can I able to now? Am I able to see, sir?
Yes, sir. Yes, sir.
Yes,
Thank you.
yes.
Thank you. Very
Okay,
happy
sir.
to see you, sir. Yes, please
Thank you,
continue.
sir. Thank you, sir. Thank you. So this all will be required teamwork, where without team it is impossible to handle the youth because if wherever we have the team, there will be definitely generate team spirit, and people will be youth will be motivated. We also require to be communications point of like we need to develop in child to have a good communication skill like listening, verbal and non-verbal, written communications. They need if they want to sometimes express their feeling, they can write the diary. They can if they do not want to express verbally, allow them to uh, write in diaries. So we came to know that okay, what the child is thinking. Sometimes they may be difficult in expressing their problems. Cooperations and teamwork. Again, I'm talking about that we require. We can never say that I alone I can handle whole universe. No, we require cooperation each other. We require help each other. So such type of mental setup or attitude need to develop in child. Creative thinking, where we need to think out of box. Sometimes we require because this universe, we in this life fast lifing era, everyone want to be a first rank. Everyone want to be in a nobody's want to be in a second. Everyone want to be in first. There are the problem where we have every day there is this new era or new such a thing will be new happens always some use of some creativities. So if child want to be struggle with that, they need to be a think out of box. So critical thinking and problem solving is very important in youth. They allow them to think separately, allow them to think logically. So this will be help to learn definitely life skill approach, decision making. Sometimes allow them to child to take decision themselves. Because whenever as a parent, as a teacher, as a healthcare member, always if we are make them to every decision of small things, then they will depend on us. So this all are life skill approach where uh, we require to be as a youth, need to be seen youth. Problem solving technique. Problem solving technique, as I was observing that my previous speaker, there are people are asking that, and sir has told that we need to be use problem solving techniques, especially in the youth. So how they can solve the problems? Any problem you have taken in your minds, any issues related like academic failures, poverty, domestic violence. These all are the issues faced by the child, maybe having the situational crisis. So whatever the problem they are facing, they must be have mindset where they need to be in these steps. If they are following, definitely they will come out with the problem easily. So these are the tactic like whatever problems you have to take in your minds. Like just for example, whatever like if they are problem in academics, they are not able to read properly, or they are not able to concentrate in studies. Concentrate in studies. So this is the problem. Define the problem. Then work out the goal of each problem. What are the we have to work out that what is the problem exactly and what is the goal behind each problem. Real third step where brainstorming. The meaning of brainstorming is a little bit we need to exercise where possible solution can come out. As a youth or as a child, they need to see that there are different where there is a problem, there is a possibility of solutions. So always try to make a different directions to solve the problem. Not only one direction or not always be any only rigid to only one solutions. So if you are having multiple possible solutions, this will be help you in third state. Now, four, rule out any obvious poor options. Out of that, just for example, you have taken five or four possible solutions. In that, you have identified that which one is very poor options that we have to be removed that. Next is weight out of the pros and cons of it. And remaining four options, whatever you have selected, in each of that you have to see that if I'll take this one, what is the pros, what is the cons. So that will be help out in the pros and cons of remaining options. Identify the best option out of that four, and there is a time to put in that actions. and let's see that whether it's working or not. Let's call reflect how it's went. So if the youth are following such type of techniques in use in daily day-to-day routines or in whenever they are finding any problems, it's easy to solve their issues. Next, good parenting skills. Here I would like to give an example, like what happened in movie like Tare Zameen Par. Like there was a teacher, good teacher, who observed the child problem, but same side family was not cooperating, family was not supporting, because they are highly educated, even though they do not uh, think on different way. The teacher was who have able to see the child problem. So here definitely in youth we require very good parenting skills. Like in majority of the Indian culture, I sorry to say, but especially in the when the child is school stick or school time, we are always scolding the child that you are not doing homework, he's not punctual to the time, you are not reading. So we always scolding the child, or we always criticizing the child in negative environment. There is also need to be child to be seen positive behavior also, because each and every child is unique in this world. Each and every child have their own capacity. Some child maybe times 3 times they learn, and they are understood. Sometimes in sometimes some of the childs are very in first attempt they will be succeed. So it doesn't mean that they are poor. They have their own space. Some children maybe have in very good sports, but some children maybe have very good in the academic sides. Some children maybe have very good in drawing or art. So as a teacher, as a family member, as a parents, so here I'm talking about parents. So as a parents, we need to child strength, where when we are observing weakness, there is a right to see the strength also, and also always appreciate the child whenever he is doing good. Teach child to focus on need of others. This is the second parenting skills. Don't shout at children. What we feel like I'm the masculine because of your age, we are the powerful muscles, we are having good energy, and child is very small to us, so we can rule out him. We cannot fight the same age group, but we here in the family what we are doing, who is the small, who is very low in power, that whole aggressions of office aggressions or whatever you in whole day, what hectic life schedule, this will be directly released on children. So this is the good parenting skills. Next, give your children responsibility around the house. So sometimes it's required, especially that how children in their age, when they go married, and later on they have the responsibility of their family, where they go to and marriage. So where we in this initial stage only we require some small responsibility due to the house, so they can learn how to make food, how to cook, daily cleanings. This all will give diverted as well as helpful in some productive activity, and they will be helpful in somewhere. Some of the percentage will be relaxed in their upcoming futures, because early age, or if we are early identifications, is very important. If you are giving some responsibility later on, they when they will be become a father, when they become a mother, when the role changes, they will understood, okay, this responsibility is supposed to be taken, and I did. How they will be imitate, they will think about their mother, how was my mother doing. So there are small responsibility also need to give if the child is capable. Build a strong relationship with your spouse. That is also because in majority of mental health disorder, we are learned that mother-child relationship or father-child relationship, how the parents are relationship with the child, very important for that. Because if child is observing that domestic violence is going on, my mother and father is fighting each other, same way they are imitate, they are copy, they are out, they are empty box. Whatever you want to put there, they will be, it will grow. So this will be relationship is required. Teach your child to view challenges as a positively. If the child is getting challenges, tell them to these challenges positively. Don't think, tell them, कोई बात नहीं, हार गए तो हार गए, लेकिन at least we have to participate. That is also child to be, I can say, don't do things your children that your children should themselves. Don't always give spoon feedings, because this will be habituation to the child, and there will be a part of habit. Every day, every time they will ask you, can I go for cycling, can I go for gardens, can I go for this? So this will be dependence. This will create child to not take decision making their own. So help your children develop social skills. Sorry, these all are the good parenting skills Now, similarly, in this primordial approach only, we are going to learn about distressing exercise. Like this is the exercise we can teach the children whenever they feel stressful situations. Like if they want to exercise, just sit quietly with your clothes, just sit quietly and close your eyes. Simply take a moment and contemplate, reflect, think about, you have to chill or you have to think about what the problem is going. At least whenever they are feeling stressful situations. Second mindful activity like pause before you speak and act. This is the most important because once a word we have speak some things, it will not come back, go back. So pause, take a few seconds break in between, take a pause, take a 2 to 3 rings. Whenever phone is ringing, directly some people are very impulsive and directly open the receive the call. At least think that what about my intention to receive this call? Next, be fully present. Deliberately give your full attention to whatever is to you're doing. Whenever you are with family, friends, focus on being fully present with them. When you are at work, directly you have to focus on attentions there only. The meaning of nutshell is that wherever you are, give your 100%. That need to be very helpful for the child because if you're in the dilemma like you are physically present in the class and psychologically point of view are thinking, okay, I have to go and eat ice creams, I have to go and play the cricket. So that will be not productive work, whatever you are doing. Be right here, right now. If you're talking to someone, think on properly focus on that only. Don't think about past and present, what happened with that, and do not always in the mindset that what was happened in past, what was going to be happen in future. Live in presence. Like famous dialogue in 3D, it's like future ka nahi, aaj ka soch, abhi ka soch. So that will be a very helpful. Practice mindful stretchings. Wherever child feel like they are stressful situations, they require a little bit stretch of their body, which will be, and they need to require where they need to monitor their breathing. This is also helpful to relieve the stress. Last, where we can say whatever it's you are doing, just do that. If you are making a cup of tea, just make a cup of tea. If you are spending time with your child, just be with your child. Normally what happens like parents are after late night or like after office hour they come to the home, they are doing their work to the home of office work, and they are listen their child what they are saying but not actively. They are engaging their office work or they're busy with their computers. So this will be child not active, you are not active listening to the child what he want to say. Maintain eye contact with them and listen to them properly. So these are the exercise we can advise to the youth where whenever they feel stressful situations, these are the distressful exercise which will help them to improve their mental health. This is all about primordial preventions. I'll a little bit recap whatever till now we have learned, like social skills, primary preventions, or problem solving techniques. These are the major which I would like to highlight on the primordial prevention, which will avoid or we can prevent the youth mental health issues. If we talk about primary preventions, individual and family related determinants of mental health, like there are some risk factors where we need to think about, like hectic life schedule and sedentary lifestyles. Everyone have nowadays, everyone is very full of uh, work and having a hectic life schedule, very little time to family. So in these situations if the person is very easily frustrated, so required to be controlled meditations, religious activity and exercise. Similarly, there are some risk factors like youth, like academic failure and scholastic demoralizations. Here, if child is not performing well, here they require support of parents. When I was in my as a postdoc administrator, I was to talk to my children, students, nursing students, that there are the three pillars in your, like when I was students of as a administrator post, I was talking to my children that there are three pillars. One is your father, one is your parents, one is your teacher, and one is you. This whole three will make your futures. Your parents will pay your fee. That is their responsibility. This is the one pillar where they have to pay their work or pay their child fees. Their role is finished. But no, not that completely. The only thing is that not only that you are paying your child fees and your role is over. No, we also monitor whether my child is performing good or not. Second pillar, like teacher. Teacher has to give good quality education. If they are doing anything wrong, then they are responsible. But teachers doing their good role, parents are paying their fees, then who has to be third person? The children itself. They has to be good result, not only good result, but at least give them at least some productive, so that the money that you are investing on them, they will not waste. So this, like academic failure and scholastic demoralizations, such type of motivations required to be a youth as well as good parentings. Mother, like both husband and wife, they would be have good interactions for the children. They need to be a talk for, they need to be have some quality time for the children. Again, another risk factor like family conflict and family disorganizations, where we require positive attachment and early bondings, exposure to aggressions, violence, and trauma, especially when the childhood trauma. Child is observing if anything is wrong in his childhood life, like is there any violence, trauma, especially death of loved one. In such situations, they requires conflict management skills, stress, school psychological support. Here, the role of schools psychological support are very much useful, because the problem is in home. So here, when the child comes to the school, where they can get support. Next is loneliness and cultural shock, where pro-social behavior we need to be help of this pro-social behavior, we can control the child. Like what do you mean by pro-social behavior? That we can help without any strong reason, without any selfishness. We just help, like you are saying that one elderly walking in roadsides, you are just giving them help. This is also without any strong selfishness or without any strong reasons. You are just giving them to help. That is a pro-social behavior, helping or positivity to give someone. Medical illness and neurochemical imbalance disability, where we have some of the disease conditions like Parkinsonism, but it's not related to this age group, but epilepsy, obsessive compulsive disorder, where is this some of the scope where having the surgical support. Substance abuse, access to drug and alcohol, we definitely this age where they have diverted, they might be go for somewhere else. So in these situations, they require de-addiction self and self addiction center self. Stressful life events like anyone loss of loved one, death of spouse, death of or divorce, this directly affect the child, because this trauma will be long lasting. We think okay, this child is now okay, but in that moment, whatever trauma psychology he has received, it may be affecting his upcoming futures. That repressions or that depends, like whatever the emotion was suppressed, but somewhere it's still in their unconscious mind. And whenever next related to that problem arise, it's going to affect. So this is all about the primary prevention. Secondary preventions, we little bit like how we have to be early identifications, like screening programs supposed to be in school, university, industry, recreation centers, wherever we are youth are studying. We need to be identified that child level of self-esteem, child level of depressions, whether they are suffering from any anxiety disorders or not. So need to be scrutinized or screenings. Early diagnosis of mental health is very, very important at this stage, because when we early identifications, that early we can start the treatment and we can minimize the risk complications related to the mental illness. Screening of substance abuse disorders. Uh, Youth here, these are the chance where they can divert it. So we need to find out the screening of substance abuse disorder. Pay attention to warning signs. In upcoming slides, I'm going to show that what are the warning signs youth are showing. Get routine medical checkup, and especially don't hesitate to ask for help. Why we are talking don't hesitate to ask for help? Like if the person is having fever, definitely immediately we as a parents, as a teacher, we are very much panic. Okay, child is getting fever and we have to go to the hospital sites. But what about if they are suffering from stress? Who care? No one care. Okay, this normal day to day of the pagal hai. This way we are speaking, this is the stigmatization. So this my special request to you, that if you feel any stressful situations and you feel that on a low mood or a very high mood, uneasy to out easily come out from the bed, getting the problem related to sleep without any strong reason, you feel cry, these all are warning signs. So immediately don't hesitate and ask for help. These all are the treatment point of view. We know very well that we require pharmacological treatment, psychotherapy, group therapy, cognitive behavior therapy, biofeedback, These all are the therapies we can. This will be help to and minimize their problems related to mental health issues like vagus nerve stimulations, like especially the helpful in epilepsies, transcranial magnetic stimulations. This also helpful in anxiety disorder, electroconvulsions, surgical treatment. So here I would like to give secondary prevention. Well, famous celebrity like Bollywood Deepika Padukone. She had I was wonder that how she has daring and openly with publicly about his issues. It's very I appreciate that how she can be open with these whole issues. She has given his interview to WHO where she has all symptoms that discussed that she was feeling of sadness, so she was socially completely cut off, reduced motivations, she was suffering from helplessness. Even they and the major role was in her diagnosis was her parents, especially her mother. She identified and she immediately told that okay, we will go and see the psychiatrist. So this is the very important. And now she's we know the her status, how she is. So early diagnosis is very important in such situations. We require sometimes pharmacological type antidepressives. So this can help us. Now I'm going to discuss about what are the prodromal symptoms or warning signs, especially in youth. Like they are confused. If you can, this all symptoms or signs we can observe in children, then it's definitely immediately need to go for health checkup, especially mental health checkup. If they are feeling or experiencing, seeing, hearing things which not there, seclusions feeling, self-injuries, suicidal thoughts. They are having problem with concentration loss, changes in school performance. Drastically, suddenly child is performing very good marks and next upcoming exam, he's or whatever the second results, it's very low. So where we need to think that why this child has drastically changes in his academic performance. So anxious, find hard to sleep or sleep more than usual sleep. So these all are the warning signs we have to observe in children as a mental health team member. This type of the questions we can directly ask the youth. Like, do you ever feel angry or uh, very worried? Do reckless things that could harm you or others? It means that you are आपको ऐसा लग रहा है कि आप बहुत लापरवाह कर रहे हो. Feel grief or long time after loss of death, like the grief feeling, like they are starting with they feel like okay, these things happened to me and they are not come to the stage of acceptance, like dabra denial, then anger, bargaining, depressions, and acceptance. These supposed to be growth in this stage, but they are not going completely to the acceptance stage. Think your mind in control or out of control. Do you ever feel this? You ever use alcohol or drugs? Do you ever exercise, diet, and binge eating obsessively? Do you ever hurt other people or destroy property? Because these all are the symptoms of conduct disorders. Or the second line, like excessive diet and binge eating is a type of eating disorder. So if the children are feeling such type of very high number of, can say, the severity is high, then immediately need to go and take help of, especially my advice to you that if you feel in anything of these, you might to take help parents. If you're not responding proper parents, you can talk to your teachers, school counselors or physicians, or especially you need to go and meet counselor. So these are the warning signs. Tertiary preventions here. Now still we try many things, but even though we are not able to control, like the problem like the learning disabilities, right? Where here again I'm going to give the example of Tare Zameen Par, where the child is suffering from dyslexia and who was noticed by teacher have noticed, but he was able to minimize his problem. He was this is not visible to everyone. Even parents are not able to study this problem, especially learning पढ़ने लिखने की बीमारी जिस normal routine we are saying. So this was the real struggle of that child, but who has observed? The teacher has observed. So we can this whatever problem they have, we can at least limit disability or limitations. At least we can control by help of family support, counseling, compliance toward the long-term medications, as well as when we require de-addictions. When the child is using drugs, child is using alcohol, so that time they require. I can say this whole preventions nutshell. I can multidisciplinary approach or multidimensional approach. Not a one person can do everything for the child. There is a role of teacher. There is a role of parents. There is a role of mental health care persons, psychiatrists, counselors, psychologists. These all are sit together and plan for the teacher, their prevention point of view, especially the youth if they are feeling children of who's having such type of issues. So last is the rehabilitations. What you understand by rehabilitation in this point of view in the children, especially because still they just not started their future and they have level stigma. They have the problem of disability. So we want to be independent then. This child can also productive in their life. They can also go for a job. They have the right to be a normal routines. So these all are required for child rehabilitation, social and family support, workforce accommodations, community residential services, support employment. As sir has my, as much as possible, we require less installation, especially in case of children. But if we feel okay, the problem is more serious, then we need to admit. Otherwise, as much as possible, we literally more or less advise to be go for the institutionalizations. We require ecological support, like to reduce the potential stresses and create social support. These all are the part of rehabilitations. So this all till now, whatever we have seen, this is the prevention perspective. Here again, little bit I'm refreshing you help of these slides. Like you can able to see, Seema, just I'm little bit break, taking break. Can you able to see these slides? Hello?
Yes.
Okay. So these slides, you can see in these pictures, like when a general setting, like when we break a bone, what is our reactions, or what in fun way we are saying, okay, you can, I break my bone, you can sign my cast, or like we are having, this is our attitude towards this general setting, general related problem related to bone or fractures. When we get a bad cut, we are having this, we counting the stitches. Oh, I got 12 stitches. When we get the flu, we're thinking, okay, it's a time to take holiday. But what about struggle when we having mental health issues? This one, no one will speak about this. And no one, if the people are able to speak, but no one will be have that much of support. People are labeled stigma, or people, okay, wo ja raha, dekho, wo pagal. This way they are labeled there. So there is a early identifications. Later on, we don't want to be child suffer with the mental illness. So whenever we found any stressful, there needs to be early identification in youth. So this slides, you can see how the development phases, like from conception to young adult, from prior to prenatal infancy, early childhood, adolescence. So here we are talking about adolescence. So here the parent skill trainings, parenting skills training, social and behavior skill training we need to give, preventing substance abuse, how to control their aggressions, risk prevention of depression, because nowadays the age of mental illness is day by day reduced. 8 to 10 year of child also can suffer from depressions. Child saying that I want to go to God, and we are saying that okay, my child is spiritual and he is believing in spirituality. No, he is giving a suicidal statement. So such type of things we need to take immediately. Early identification is very, very important in this phase. So prevention focus on specific bereavement, divorce, parental psychotherapy, parental substance use, parental incarcerations, community interventions, policy. These all things we can prevent the early intervention. We can have the good intervention for the mental health. If we go for multi-sectoral approach, and we seek this mental health issue on multi-sectoral approach, like individual, family, community setting, school point of view. So there are different sector, like if you talk going to give intervention in adolescence point of view on individual basis. So in such situations, how you are going, like formal avenues, like general routine, like we are giving individually, we are giving psychotherapy, pharmacotherapy, emotional and behavior interventions. We require peer support, crisis counseling, we can say community referral pathways, detections, management of hazards and harmful alcohol and drug use. We have to find out that whether they are having such type of alcohol or which is harmful to their body, or drug they are taking, management of self-harm and suicidal risk, care of children and adolescents with development delay. These all are saying in that of individual point of view. If we require to intervention on family base, then early intervention point of view, like as we said that mental health and death of family members, especially the youth, when they are suffer or trauma, when they are having their death of loved one. It focuses on mild diseases, especially. Then they are marital discord, separations, environmental disaster, economic disadvantage. So children and adolescents may require intervention to ameliorate the effect of abuse, neglect, parental substance use, especially attention to genetic causes like environmental factors, interaction between these two, that several childhood disorder and some of these preventable. So some of these childhood disorder also preventable. Like example point of view here, last paragraph you can see prenatal diagnosis, importance of counseling, including premarital counseling, very important. Have history of mental illness, early identification of phenylketonuria, where child antenatal times we see the PKU blood test, where child is having mother is having the musty breathings and redness, hyperactive. These are all symptoms of PKU. So if such symptoms are persistent, it's a rare genetic disorder problems, but we need to be checked up. Prevent mental retardations, cretinisms, iron deficiency, malnutrition are also easily correctable as well as preventable conditions. So here I would like to highlight these things we can early identification help to the children. Community interventions, like as we said that awareness, literacy, demand, this all will increase awareness day by day. People are prevention of adolescent suicide. We need to, as a community intervention, we need to think about adolescent suicide, substance abuse, self-harm. There are some prevention and emotional disorder like suicide, substance abuse, and self-harm, including life skill education. So such situations, there are certain NGOs like Atmeta. I was searching about the what intervention we can give in the community point of view. So I come across that one NGOs like Atmeta, which is MVU name, like people are especially in Mehsana. This Atmeta project where people are working on community level. They have three levels like community reference. Second one is can say champion, and third one is that local mitra. Like these are the three persons they have settled. These are three cadre we can say. First is community reference, second one is champion, and third one is mitra. So they are three category or cadre wise people who are setting in their NGOs, and they are work in community, and they directly, those who are in the rural area, they directly contact with local people and ask them if you are feeling any issues related to mental health, please ask us, please contact us. So the mitra will be contacted the champion and tell them, okay, this, I think this in my village this person is having the issues related to mental, kindly go and talk with him. So champion will go and asking about or telling their problem, asking their issues. So it's a very good NGOs which will really working for this community point of view, and they find out the youth issues also. They are also thinking that who is more addictive in this village or related to drug. Somebody is taking drug abuse, somebody is people having the alcohol. So these all can be minimized or early identification, which is really helpful for especially in the community point of view. School interventions. We require peer education program, teacher training program. This was the program was going on last year, Kishore Swasth Karyakram, but in this pandemic, it was not that much of, but still the adolescents mental health last year Kishore Karyakram was implemented for especially the youth. How they can school intervention like improving academics, like improving their memory, concentration, like meditations help a lot in their improvised concentration, intelligence, observation, learning abilities. We need to find out this all in, we can go for improvement in this all area. Similarly, improve social relationship, where making the child understand parental relationship, peer relationship, and behavior pattern. Last one is understand the real vision of life, making the child plan life by learning what, when, where we have to do, what are the mechanisms related to mechanism, sex, love. These all things need to give educated to the child. Next questions come in mind if we talk about in school point of view. Why children need school psychologist? Because these are the problem maybe have been the child, like learning difficulty, behavior concern, attention problem, or problem at home or with peers, fear about war and violence, terrorism, like we see in Ukraine and Russia war, how our children are feeling about there. There is an example of fear about war and violence. Depressions and other mental health issues, lack of guidance regarding life management. So work with children's parents can stand to help determine. These all are the area which we require improvement in child, like academic skills improvement, learning attitudes, social skill and behavior issues, personality and emotional development, identify potential learning and difficulties as much as early, foster tolerance. We need to nurture them, appreciate of diversities. We are living in such countries where all religions, so that will be helpful to and more socialized, create safe and supporting learning environment. We create such an environment where children will have a safe and they will be have good supportive environment. Next is work face to face with children and family, social skill training and behavior management, generate new knowledge of learning and behavior, deliver school linked mental health services. Whenever you feel okay, so there is a, you can also take the help from the school sides, intervention of clinical psychology wherever they require. Many mental health problem children are associated with family disruptions, some of special circumstances, like it is observed that those who are special type children or special circumstance, they require 5 times more to the general, they require much more care. Even especially learning disability children are 4 times more likely to have mental disorder, at least 40% of young offenders. This need to be really understood as a mental health team members. Next, in many cases, intervention that make a differentiate will come from another services, like behavior problem. Now, how it can be connected with literacy? Because behavior issues like attention deficit disorders are come under the behavior problem. So, such situations, how we can connect? Because child is educated, they want to learn some things, but this is the literacy problem are also addressed, where children need to be, parents also need to be aware about that problem. Children attention deficit hyperactive disorder, where child has 3 types of problem: attention, hyperactive, and impulse. So all these areas need to be related to their literacies. Lack of provision in one service may impact on ability to other services. Effective partnership working an essential requirement of high quality service provisions. The most worrying trend, growth, like family is a major contributor to individual self-esteem. As starting of my presentation, I was discussing that really need to be improved child self-esteem. We as a parents, as a teacher, we always think, or majority of the time we are thinking on one perspective, like ये तो डफर ही है, ये तो इसका कुछ नहीं होगा, या likewise we have mindset for the children or youth. So if anything's good by anything's at least some of the work by good thing done by the children. Like here I have shared an example, like one girl Sam passed in English assessment, she's performing very good in achievement. She and bought her new and bought the achievements, parents gave a new toy for that. So she really wanted and she really want for them. So that socioeconomic well-being well reduced in situation, increased in situation, and she is being praised for her parents at good efforts, and her improvisation of self-esteem is more. She think, okay, I will go for more achievements. So this will be helpful to improve their self-esteem. Majority of children are suffering from gaming disorders, or they are having the problem of social media. There are three types of social media. Like first one is the news media, where we getting the news. Second one is entertainment media, where we are getting the problem related to entertainment, and the apps, a mobile app, where where children are gaming, playing the games. We very well know aware about the gaming disorders, especially the blue whale, how the children are doing suicides. So these are very challenging to youth. This will be, if how to this can be minimized, as sir has discussed in the previous, like media also have both sides, pros and cons. If you are taking the positive side, you will be connected with your youth, you will be able to see the Twitter and what exactly what is going on. So this will be good sides, but same is opposite sides, where if you are misuse of social media, there are some apps which can uh, lead to the child depressed. There are some games which will child go for the suicides. So when as a parents, we have to think about that Facebook security app, Google security app, YouTube Kids Safe. These are the app where when we are going to children of such want to be utilized media, social medias. So such the moment we are restricting or allow them, and we cannot decide alone. We sit together with the child and togetherly take a decision. That will be more useful. So especially we want has some special youth point of view how to improve mental health while using social media. Monitor your screen time, be more selective. Be more selective in monitor your screen time is in a 24-hour how much hours you are using the mobiles or use social media you're using. That need to be seen. Be more selective, like be more selective where how we can see that that if somebody is sending you friend request, so we have a little bit before accepting the friend request or join some group, we need to think, is it related to my work, is it related to my a demand or where I am interested, then only. Otherwise everyone we are allowing them to a friend, we are allowing them to join in our group. It might be we don't know which some front persons in which dilemma, which mood and sending the message, so that can also affect our life. So better be more selective to whom we have to connect it with in social media. Take a break with social media. Not, it's again detoxifications, like some of the times in a week, at least in a day, we do not touch the mobile. That is also we can avoid from and go for outing, go and friends whenever we are talking with friends, do not use mobiles. This will be good for the children also. Be mindful and be mindful of the day. We think that okay, social media के बाहर भी कोई life है. Think about that point of view. Limit where you are using, why you are using. We think before you are using. So these all are the few tips we can improving the mental health. Next, prevent adolescent suicide. Very burning issue nowadays. Like children's made to work with their parents. As a father, I can also say that when we are role of parents, we can think, okay, I can do whatever my child's demands, whatever they would like to require, I can give you. I always try to become happy for my to be whatever require for my child, I will be do for that. That is called, we always as a parents allow them. Parent can endure anything for their children. They can biggest sacrifice for their children. When the child is in pain, definitely parents are also more double or triple feeling of the pain, because they are that bonding is with the parents, that if child is in pain, definitely the parents are in more pain and they are, it's unimaginable. The problem is that, but no matter how much effort we take to keep our children happy, how much, this is a very important line I would like to highlight, that no matter how much effort we are giving to make to these children happy, we often can't comprehend what's on their mind. Sometimes children are very uh, clever, or they know okay, this moment if I'll show any expressions, they understood me, my parents can understood me. So sometimes parents are fail to understand their child. They are, there may be some thoughts, emotion or fear in their mind and they don't share with us. And if such situations arise, parents pay a huge price for that. That is suicide. So this why I'm sharing this all, because whenever we feel that my child is not appropriately behavior, his sleeping hour is either maybe very excessive, maybe reduced as per the routine compared to the routine, he's not eating well. This are somewhere something is happened to the child. So I'll ask them to sit and directly talk openly. As a friend, we can ask to the child. Again, I'm saying to say that in age group 15 to 30 years, what kill most people in India after road accident is suicide. When person suffer from pain, the mind is fractured. This is more important. Again, I would like to highlight that mind is fractured in the point of view, like people are suffering from mental pain. And that moment, their mind is fractured, and that is invisible to not all, but where majority of the time it is invisible. And that conditions, mind is often stressed. Person is shattered, but the mind is fractured. In these situations, unable to sleep. Children are short-tempered, they are showing temper tantrums or whatever symptoms they are having. If nothing seems good, if child feel like working, if you're observing such symptoms in the children, there is a need to go for mental health checkup immediately. There is a need to be meet counselor or psychiatrist to find out if mind is stress or fractures. This whole presentation, if you not listen, no problem. But if as a youth, if you're listening me, whenever you are feeling any low or if you found that without any strong reason you are feel to cry, you are routinely changes in your life, like you are not eating, not able to eat properly, somewhere you are feeling uneasiness in your mind. So definitely, immediately need to go for mental health checkup. Don't wait for the time that okay, this is not, and no shame for to go to the mental health checkup. In the Indian setup, this is the most major issues we are facing, that people are stick. People label it as okay, he's a mad, he's mental people. So the cure possible just insulin, how to reduce diabetes. Similarly, counseling and medicine can also reduce the mental issues. If you are found the following thing in your child, like as a teacher, as a parents, if we are finding the children are like they are unable to do simplest work or talk to anyone, there is few simple work. Uh, like they are feeling like okay, I have to submit this assignment after few weeks also. We have enough time to submit, even though they are feeling the severity of the submission of that requirement. They feel that oh, I have to submit this requirement. Even they have sufficient time, but in their mind, it is the most heavy or most difficult work for them. So this way, if they are feeling noise seems unbearable, they are feeling a problem, hallucination solutions. They want to live alone. They have statement like I want to go far away. If such statement child is passing, my family is distressed because of me, I want to die. They wishes to go to God. Like people are children are saying, like especially I heard from somewhere that children's parents are going with children and go to the psychologist and saying that મારા છોકરાને અધ્યાત્મમાં બહુ રુચિ છે, मेरा बच्चा अध्यात्म में बहुत इंटरेस्ट रखता है. Then psychologist says that your child is not spiritual in this age. He want to go to God means he is having suicidal statement. So nowadays the lifespan or age limit of mental illness is very reducing. The 8 to 9 year old or 8 to 10-year-old children are suffer from depressions. So statement should be taken seriously, and immediate mental checkup is very important in such situations. Eliminate stigma associated with mental health conditions. Often people think humiliating to go for mental health checkup. Often they'll think mental patients. People feel ashamed, but they should not be. We are always feel that okay, if somebody look me, if I'll go to the mental hospitals, why with them, how they feel this. Don't feel ashamed when you may have a fever, then why we have to go? Why we cannot go to the mental hospital for mental, even at least we can't go and meet the psychologist. We should have the same perspective toward the mental illness as we have having physicals. When child doesn't feel like going to work or schools, lying on the bed, all they should ask them directly, are you troubled with thought of suicide? There is no harm to ask direct, open-ended questions. So at last, I want to give a message from the youth. This message from, if I'll say, I know that much of effective, but believe me, I'll take this message from movie of 3 Idiots, where the message from the youth, like don't chase success, but achieve excellence and success will come to you. कामयाबी आपको पता है कहाँ से आएगी. कामयाबी के पीछे, सक्सेस के पीछे मत भागो आप, वो आप एक्सीलेंस में अपना ध्यान रखो, it will become automatic. Next is believe in yourself. Whatever you have to be in, believe in your sides. You have to be improve your confidence. It will be improve your confidence, and do whatever you love. This is the message for youth. If you feel anything's high or low in between or in your childhood life, definitely there are numbers like 1089 that night and day where you can take help. Even people are doing online counseling also. There are national suicide and crisis lines, alcohol and substance uh, abuse related counseling helplines, domestic and sexual violence, eating disorder. So these all are help telephonic counselings in India. This link, help of this link, you can see there are number of counseling centers on where they are giving free of cost. And if you want to hide your identity, they never disclose your identity to anyone. So Nimhan's helplines like Suicide Prevention, Sneha Foundation, Huge Mental Health Foundation, Sahai Helpline, Fortis National Helpline, Asra, Roshni Trust, especially Bandrewala Foundations. These all children take help whenever they feel any mental health issues. These are the reference, and this is all about my presentations. I hope I justice with this talk. Thank you very much once again to Virendra sir and his team, Dinsha Patel team, to give me this opportunity to talk about on this very important topic for special youth. So thank you very much.
Thank you, sir. Sir, one question from audience. Can mental illness be permanently cured?
Mental illness permanently cure, it's depend on the situation, severity of disease and its variety of disease. Like there are depression. I like to see the example of Deepika Padukone. How in his early age she was suffering when was she debuting in the film. She was suffering from mental illness. Depression was the most suicide. We can lead to the suicide, but nowadays she's completely all right. So it's the person we can say vary from disease to disease. Like people having mental retardations we cannot permanently recover. So this, as per my understanding, I think that this is my answer, that mental retardation cannot be completely recovered, but at least we can limit their disabilities. We have give them child to quality. We can them to train some scholastics. So this is the answer from my side.
Thank you so much, sir. Thank you, sir, for your sharing the knowledge and the expertise. So now I would like to invite Mr. Ronak Parmar, nursing tutor, Dinsha Patel College of Nursing, to propose a vote of thanks. Thank you, sir.
Okay. Good afternoon to all the respected dignitaries and delegates. I, Ronak Parmar, nursing tutor, Dinsha Patel College of Nursing. It's my privilege to present a vote of thanks for e-conference on adolescent mental health organized by IQAC and Department of Mental Health Nursing. Firstly, I am heartily thankful to the management team for facilitating conference with constant support. And I would like to convey my sincere gratitude to Dr. B.H. Salet sir, Director of Dinsha Patel College of Nursing. I indeed grateful to you, sir, for your continuous guidance and enormous support as a backbone of this conference. Thank you, sir. I would like to express my profound gratitude to our today's speakers, Mr. Iresan Kappa Mudakavi, Faculty of Nursing, All Indian Institute of Medical Science, Jodhpur. Thank you, sir. And Mr. Jayesh Patidar, Associate Professor, Department of Mental Health Nursing, Gitanjali College of Nursing, Udaipur, for sparing time from busy schedule and accepting our invitation to share your knowledge and taking a time for this conference. Thank you, sir. Thank you, sir. I like to express our sincere thanks to Principal Professor Virendra Jain, sir, for organizing chairman of conference, for giving logistic coverage in planning and organization of conference. Thank you, sir. I am thankful to Ms. Seema Boresa, organizing secretaries, Assistant Professor, Mental Health Department, for the tremendous, tireless and effort of make this conference successful. Thank you, ma'am. Here, I would like to thank all the members of Mental Health Department, and I would like to thank all the participants and faculties and students. Thank you all. My special thanks to technical committee for making this conference on virtual mode. Thank you, sir. And I thank everyone, those whose contribution has made this conference a successful one. Thank you, sir. Thank you all.
Thank you, sir. So now we are ending this conference. Thank you, all of you.
Thank you once again.
Thank you, sir.
Thank you.